So we will discuss today's should you take orthopedics as a career option after MBBS. So we'll first see what are the pros and cons of taking orthopedics. First pro is that it is an end branch. End branch means you don't have to do MCH or DM after orthopedics. So this is one plus point. Second is the surgeries here are easy to learn. Mostly trauma, it is very easy to learn, and with one or two surgery you do independently, you will be able to do all the surgeries easily. Third is complications here are not huge. Like complications here will be there will be infection of the bone, the fracture could land in non-union, or there could be malunion. It will not be like the patient had died and patient has a pulmonary embolism, patient has stroke, or patient has myocardial infarction. These kind of complications are not that much. So fourth one is these surgeries are high paying here. Like if you do total knee replacement, the surgery cost can range from 1.5 lakh to 5 lakhs for total surgery. So the implants here range from around 50,000 to 80,000. So all the other is your cost. You manage it however you want. So fifth is that the branch is not that hectic. By hectic I means that there are not many emergencies. Like fractures are not emergencies. You can just ask your assistant to apply a slab and you can see the patient the next day. Sixth is settling in remote areas is good. Like orthopedics has a large patient base. It has a high demand in remote areas also. So you can easily settle in remote or towns or the lower cities. Now coming on to the cons. First one is there is high competition. High competition is due to being an end branch. Even after passing MS, if you want to do senior residency, it will be very difficult to get a seat in good medical colleges. Second is it's very difficult to settle in big cities, especially the metro cities, because you then require super specialization like in arthroscopy and sports medicine, or in pelvic surgeries, or in pediatric orthopedics. Like that you need super specialization. So again you have to do a fellowship or you do a MCH. Seats are very less in India. So third one is post-op x-rays. You can see what you have done in the surgery. Patient can easily see that the fracture is not uniting, that the fracture is mal rotated. The patient can easily see that the surgery is not done correctly, and he can easily sue you or he can point fingers at you. Third one is that window shopping is there. The patient will take the x-rays here and there, go to one surgeon, then go to another surgeon, then ask for the price of the surgery, how much will you do, in how much you will do. So this is a disadvantage in orthopedics. Then fourth one is that some surgeries are really difficult to learn. Like in arthroscopy, it's very difficult to learn arthroscopy. Unless you do it yourself, it is very difficult, because it's like playing a video game. Even after assisting say 100 200 surgeries, you will not learn arthroscopy until you have done arthroscopy yourself. So some of the procedures are very difficult to learn in orthopedics. Then fifth is that it takes time to establish your practice, because this is a surgical branch. You have to develop patient base. You will have some complication of your surgeries. You complicated one patient, it will go and tell other patients that you have complicated the case, and then they say that a good patient will bring 2 more patients and a bad patient will deter 10 more. That way your practice will grow slowly. And if you want to grow your practice fast, you will have to work in remote areas or towns and in lower cities. And if you want to grow your practice in metro cities, it is very difficult. It will take around 5 years in remote areas or villages or towns to grow your practice. In big cities it will take around 10 years, and in metros it can take up to 20 years or forever. So if you ask me what will be my preference here, so first I think will be radiology, if you consider work-life balance too. Second, there is a tie between medicine, orthopedics and dermatology. Medicine, because you can choose your subspecialty then, like you can go into gastroenterology, oncology, DM cardiology, and if you do DM cardiology and then open a cath lab, the money is endless. Then orthopedics, because it is an end branch, the surgeries are high paying, the surgeries, most of the surgeries are not that difficult, the trauma, and you can settle in remote or peripheral areas. And then dermatology, because again work-life balance is good there, you can go into cosmetics in dermatology, and then it can be hugely paying branch. On third number I will keep pediatrics, then anesthesiology, ophthalmology, and so on. And whichever branch you choose, try to provide value to the patient. This is the most important thing. Don't run after money initially, and do what others are not doing. This is the only way which can make you successful. I hope you like the video. See you in next video. Thank you.